Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello. My name is Joa Rivas, and I welcome you to Back into Alignment podcast. Every Friday, we deliver information related to back into alignment, basically back into our best optimal life. This is a podcast related to spinal health, especially for those that are suffering of any type of spinal dysfunction. We're talking about simple as a neck pain, postural problems, to very severe issues like sciatica, osteoarthritis, and many health conditions related to the back pain. This podcast was created 4 years ago, and I wanted to thank you now in December for being able to be a fan of us, listening to us every week, and all the questions and comments we really value. So thank you so much for being there with us. It's exciting, and every week we keep growing. I wanted to first welcome you to enjoy the holidays coming so soon. I wanted to have time for you to be with your family and your friends. I wanted to wish you an amazing time, especially having those yummy meals. I am excited today to welcome the fourth episode with Dr. Adil Khan. He is a doctor expert on pain medicine and regenerative medicine, which is in the top edge technologies, is actually bringing technology to our health, which is so important. Many doctors have been stuck into the traditional thinking, traditional solutions, traditional medicine, and I'm actually excited to bring doctors like Dr. Adil that is actually expert in this type of approach. We are always searching to the latest technologies, especially in terms of pain medicine and sport medicine. He is going to join us very soon. I wanted to also welcome you to a new year very soon. We are doing a hip healing program, which is a 30-day program that has been running this year. 30 days where you are able to exercise for 5 to 10 minutes. So it's a very short commitment that gives you big results. By stretching your hips, you will be reducing not only your stiffness on your hips, but also around your lower back that is related to this area. So I welcome you to join by checking my website, joafitness.com, and checking the hip healing program. It's a 30 days program, right? A fitness app that you get into your phone and you're able to play anytime, anywhere. And you only need your body and a yoga mat to be able to stretch. And some of these stretches are actually done in a chair. So even if you are at work and you are at the office, you always can take 5 minutes of a break to stretch your body. So the most important of this program is to have a habit, and the sums of habits, it gives you the life that you are in this moment living. So if you feel that you are stuck physically, you feel stiff, this program is awesome. It's only 30 days. I'm sure you will see the evolution on the flexibility and mobility of your hips and your back. So I'm welcoming you there. And also, if you do have a little bit of a serious problem with the spine, like scoliosis, like I used to have a lot of pain my spine because of scoliosis, or even if you have any type of postural problems, I actually invite you to check my website, especially the Posture School program. It's a program that I developed 2015. It's been about 7 years out there with over 1,000 people practicing this program. It's been very motivating, successful results we have received, and I'm actually excited to continue evolving the program, not only for the core strength and stability, but we also have been adding more modules related to the eye training, the release of the stress around your jaw, and also the position of your neck. And the one that is the most interesting is actually working on the stimulation of the vagus nerve. And this is all included in the 16-week of Posture School program. So you also can check this on my website, joafitness.com. So let's just get into our nitty-gritty today. We will be talking about regenerative medicine for the last time with Dr. Adil before he heads into the tour in Dubai and Italy. He is now going to be attending us today from Mexico. So I'm actually excited to hear what he's now learning and the discoveries that he has done this week in the tour in Mexico. So thank you so much. get comfortable, get your tea, get your coffee, depending on the time where you are. And let's get to listen to our conversation with Dr. Adil. Happy Friday, my friends. Welcome to Back into Alignment. Here, Joa Rivas in Toronto. Excited to have our last talk of the year 2022. Yes, it just complete 365 days so fast. I'm not sure if you actually felt the same like me, but it was one of the most accelerated year in many ways. I think we were stagnated for 2 years at home, isolated, going inwards. And now when we got back into the regular life, I think we accelerate our activities, and we kind of try to catch up with everyone and with all what we couldn't do in 2 years. So I first wanted to thank you for being part of this podcast, this community, to develop awareness about our posture and also about the solutions that we have in our hands. The last guest of the year is Dr. Ken. He actually is pain medicine expert and a sport medicine expert, and actually so excited to have him for the last guest on this year, because he has been bringing the cutting edge technologies for our body to heal our body. He is actually now in Dubai. This is our last talk of the year, and he actually has been very flexible with his time. Imagine, he's been traveling to Mexico, to Dubai, and he's still here available for us. So thank you so much, Dr. Ken. How are you today?
Yeah, no, it's been a fun journey. So
Yes, well, as we are completing this year, and we are bringing awareness to what can we do to preserve our youth, the fountain of youth? Do we have a secret? Can you please tell us what are the top anti-aging and longevity methods that you have been discovering in your trips and in your latest studies?
yeah, so I think I think people who watch your podcast probably know about the fundamentals, which are like exercise, sleep, stress, community, and nutrition and all that stuff. So I think that's like fundamentals, which most people probably know how to do. So what can we do on top of that? So there's a lot of people in the anti-aging and longevity community talking about different supplements and whatnot. But I think with supplements, it's still hard because the data is a bit mixed, and there may be some supplements that can help, but it's also something you have to take every day, which not everyone can do. So I'm personally a bigger fan of like interventions that are going to have a big benefit and are minimally invasive, and they're going to last a long time. So what fits the bill for all that? So the best treatment we have right now for that is actually intravenous stem cells. And I think we talked a little bit about it before, but it's really exciting because it's like we can take someone else's young stem cells or umbilical cord stem cells, and then we can put them through your whole body, and they'll make you younger, and they can help you live longer based off biomarkers. And it's pretty cool because they're called mesenchymal stem cells, and which means that they don't have to be cross-matched. So you don't have to match them they don't have to be from your child. Like a lot of people are like, oh, does it have to be my child umbilical stem cells? Or no, it can be from anyone. And so that's the cool part about it. And so it can help you live longer. And I think it is the secret to fountain of youth, because I can tell you a lot of celebrities, a lot of billionaires, a lot of people in the top, they're all doing it. And that's why I'm in Dubai. I'm doing it for the royal family, and I'm doing it for a lot of the elites of the elites. And it's because they can access it, and they want to, if there's something that they can do for their longevity, that this is kind of I think the magic bullet at this point, at least.
Okay, yes, for sure. So we are sharing that intravenous stem cell therapy has been actually showing the most highest results in terms of keeping our youth. Now, because our last talk was 30 minutes about only stem cell therapy, so for everyone that is actually listening to this podcast today, we welcome you to go back into a week ago, which we actually talked 30 minutes only about stem cell therapy and what are the accessibility of stem cell therapy in Toronto, actually in Canada. So we do have a lot of limitation in this moment. We only can use our own, and we cannot grow it. But there are other places like in Dubai that you can actually grow the stem cell therapy. And this is something that Dr. Ken is actually working with the University of Toronto to be able to get to this level by next year, hopefully. Now, as we were talking through the stem cell therapy, and the benefits to preserve our youth. I actually have a question from one of our listeners. They're all always looking into like the negative. I don't know why, but the human, we always try to search into like what is the worst that can happen, right? And the question is related to the controversy of stem cell therapy, which says that many people disagree that using human embryonic cells for medical research, because extracting means that can be destroying the embryo. Is it a way for you to explain in a very easy, like you just explaining to your kids, is this real, or like you from the application point, like you are right on the front line, do you notice that this is actually just more of a misconception?
Yeah, we're not using embryonic stem cells. No one's using them.
Okay.
They were being looked at, but this was probably like 20 years ago. And obviously, because of all the ethical issues, it was banned. So you are not allowed to grow an embryo just to isolate its stem cells, because obviously there's ethical issues with that. So no one's being harmed. We're just taking a baby's stem cells who was born, and instead of being thrown into the trash bin, it's being collected and isolated, and that's it.
Okay. So that's clear.
Yeah, so no,
that's very clear. We're not using embryos and destroy them. We're actually using real embryos. And what's the name of this technique? I think you mentioned it before.
The umbilical cord stem cells and the placenta.
Umbilical cord.
Yeah, there's umbilical, placenta, and amniotic. Basically, all the stuff that comes out after you have a baby. If women who've given birth obviously know, because they know what comes out. And so instead of throwing that out into the garbage like most people do, there's a company that collects it, and then we process it and we isolate the stem cells. And another thing I think just to mention about the longevity, just to come back to that, was about metformin. I don't know if you've heard much about metformin, but it's a diabetic drug, and it's actually been shown to help with longevity. Like it can potentially help you live longer, and it also has anti-cancerous properties too. So I think if there's something you're going to do for longevity from a pharmaceutical perspective, I would say metformin probably is one worth looking into. And then there is also something called there's another diabetic drug too, which is called Forxiga. It helps to get rid of blood sugar in your body, but it doesn't have as much research. But it also looks like promising for longevity and anti-aging, because anything that helps your body to process sugar better is going to have longevity benefits, it seems like.
Yes, but coming back into alignment, like our podcast, we have been talking so much about the latest technologies and the cutting edge, creating a new community of game changers and seeing the medicine from a different perspective, but at the same time coming back into the most basic, which is basically your lifestyle. Are you actually taking care of your mental health? Are you practicing some type of gratitude or some type of meditation every day? You actually mentioned that this actually has created the base out of all your medicine practices. It's actually how we are feeling, how we're eating. You even gave us the top 3 foods that can actually help us for our gut health. So again, come back into 2 episodes ago, we actually talked about gut health and the spinal health, which is something that people actually ignore, and it's interesting to see when you actually have a gut health balance, then your spine also heals. Now, like another question related to the anti-aging is related to the CAR-T therapy, which you actually mentioned very briefly in one of the episodes. But CAR-T therapy is being now used to heal or to cure, to treat cancer. Can you please tell us, and now that you are in Dubai, have you heard anything related to CAR-T therapy?
Yeah, actually, well, CAR-T. So yeah, the scientist I'm working with, Dr. Giuseppe Mucci, he's like one of the lead scientists in the world when it comes to stem cells, and he has a bunch of patents. So I've been hanging out with him a lot and learning a ton. And one of the things we're talking about was CAR-T was actually finally approved to use for also a condition called thalassemia. And it's the same principle. They take a T cell, which is an immune cell in your body. So immune cells are basically, when you get an injury, they come to the site and they promote inflammation, and they help to heal your body. So you can program these T cells to kind of do what you want. So hence the name CAR-T, because it's based off the T cell. And so there's different uses for it. But the problem is, for example, with CAR-T, with like thalassemia, it costs like over $2 million to treat one patient. So it's not scalable or practical yet. And with a lot of conditions. With the cancer, it's not as expensive, but still it's in the tens of thousands. But at least they're covering, at least I think it's being covered now for that. But like for lupus, where they did that trial to treat lupus and cure that with CAR T therapy, again, I think it's in the like hundreds of thousands to kind of treat those patients. And so it's still, I think, a ways away from being practical for the average person to access, because it's a lot of gene programming and cell therapy, which is expensive. So hopefully as the cost to edit genes and program them to do what you want comes down, it'll become more accessible. But CAR T is it's kind of like think of it like a Lego set. Like you can kind of modify it the way you want to do different things. And and so CAR T is going to be applicable. Yes, it can treat cancer, but it can probably be able to use to treat a lot of different conditions that have specific pathway, like one specific pathway that needs to be targeted.
Which this is what you're trying to do with stem cell therapy, right? Just to be a little bit specific. Like now you're treating only osteoarthritis. I think you were commenting that that's one of the main.
That's one of the most common things we treat. And and that's the thing with the stem cell. I would say our stem cell therapy, even though it does work for a lot of different conditions, it's very broad. And I think in the future, we're going to have much more specific stem cell therapy where we can edit the genes in the cells to do what we want. Whereas right now, we're using it to treat a lot of different autoimmune conditions, but it's kind of like very systemic and very broad. So it can still work very well, but I think the precision of it is going to get much more specific over the next few years.
And then now that you are in Dubai, are you actually seeing more precision in a specific condition, especially related to autoimmune issues?
So we're treating a lot of different autoimmune conditions, but the protocols are pretty similar. It's just the dose is different. So it's still using the intravenous stem cells, but just a different dose. So it is still very general that way. But yeah, I think but there is some cool new technology too, which I wanted to share, was about, because we're about the topic of anti-aging and longevity. It's like, how can we help you to age gracefully and help you to live as long as possible with a good quality of life. Like one of the things obviously people do is blood work, right? People do blood work to get, like, to check if they have high cholesterol, or you go to your doctor, you get checked to see if you have high blood pressure, to see if you're at high risk of getting a stroke or heart attack later down the road. But there's no test being done for cancer. Like you just kind of wait and hope you don't get cancer. And then one day you get cancer and then you have to just treat it then, right? So we have a test now where we can actually test what's called genomic stability of your genes to see if you're at high risk of developing cancer down the road. So similar to measuring cholesterol to see if you're going to get high risk of heart disease, now we can see if you're at high risk of getting cancer. And then there's certain pharmaceuticals like metformin or nutraceuticals like curcumin, and obviously lifestyle stuff that you can do to intervene, so you're less risk of getting cancer down the road. So it's pretty amazing, because that's a huge change, because instead of just waiting to get cancer or screening to get cancer, then we can actually start doing testing early on, and then hopefully prevent cancer altogether.
And for being able to prevent these diseases, do we need a better equipment, or what do you think is the biggest gap?
So it's actually a proprietary blood test that Dr. Mucci created. And so I'm going to work with him on bringing it to hopefully the rest of the world, because we're going to partner on that. But it's basically, there's a few other companies that were trying to do it. There's one called Illumina, but it didn't have the right technology. And there's been a few others that have kind of almost gone bankrupt. But the problem is they weren't looking at the underlying causes of what causes cancer, right? What causes cancer? It's chronic inflammation, it's immune dysfunction, it's what's called reactive oxygen species from mitochondria, and it's all those factors, and gut dysbiosis, like gut microbiome, right? So it's all the same factors. And so his test actually looks at all those different factors. And there's no other test in the world that does that. So we're actually measuring and looking at how your body is affected in those different cellular pathways. And then you can intervene to correct those pathways.
And the earlier stage we can actually detect these diseases, the better. And in terms of, like, unfortunately, there are actually kids that suffer of terminal cancers like leukemia. Have you heard of any type of studies related to leukemia on young kids?
Well, so yeah, to clarify, there's two types of cancer, right? There's like what's called germline mutations, which are like genetic, And then there's what's called somatic mutations, which lead to breast cancer and cancer, most adult type cancer. So if you have a germline cancer, which is genetic in a child that might be, at risk of getting leukemia, for them, have been a few trials looking at stem cell treatments for that. But I think it's still too early to say if it's a cure, but it may help, in terms of like reducing helping with some patients. But I think the future of that is definitely the CAR T. So CAR T can be used for like something like leukemia because it can target that specific thing, and that's where CAR T is starting to be used.
Mm-hmm. Yes. So yeah, regenerative medicine is one of the most promising areas of longevity technology development, and we're so excited to have you and to know that you are traveling the world. And I wanted to give to everyone that is listening to this last conversation together, how do you see 2023, especially from your perspective, traveling to Italy? I believe you're coming after Dubai, and how do you see the medicine and now advancing? Is it like a little bit more open to the
Yes,
new
I think,
technologies?
I think everyone already sees the shift, right? Everyone's shifting from a reactive model to a preventative one. So instead of just waiting for bad things to happen, people want to stay healthy and want to prevent illness altogether. So having more advanced diagnostics like that genetic testing and having access to stem cell treatments and other longevity and anti-aging treatments to keep people healthy as long as possible is the way I see medicine going. And people want to invest in their health. Like they rather spend some money upfront and try to prevent problems than wait for something bad to happen.
Mm-hmm, exactly. Now, as you say, you try to create an accessible way, not only for the celebrities and the royal family, but also to anyone that is actually suffering of a disease, or even to prevent it. In terms of the government supporting this type of approach, I know the OHIP doesn't really, OHIP is the healthcare in Ontario, doesn't really cover stem cell therapy or any type of regenerative medicine.
Yeah, the whole system's broken, right? Because
Mm-hmm.
it's designed to reward doctors when they see patients when they're sick. It's not designed to keep people healthy. So, and I don't see that changing. So I don't think the system is going to change, but people are going to empower themselves to take in, and that's why we do these podcasts, right? We're trying to empower people to take a charge of their own health, because you have to.
Yes.
Just like when it comes to nutrition too, right? Or anything really nowadays, like exercise, you have to educate yourself, because if you don't educate yourself and you learn how to take care of your health, then you're going to rely on some sort of family doctor. And a family doctor is very unqualified to take care of your health, to be honest. They know how to treat disease when you get sick, but they don't know how to keep you healthy.
Mm-hmm. Yeah, one of the things you always comment is that you go into the source, into the origin, the root cause of any disease that goes into the intracellular level. It's not a superficial cream or a little band-aid, right? It goes very deep into our gut health and like specific issues related to the origin of the issues. And that's why you're trying to bring this awareness into what are we eating and like what type of lifestyle we are following. But in terms of the CAR T therapy, if people want to know more about CAR T therapy now that you're saying that is giving so great outcomes for people that are actually having some real issues like cancer, I wanted to know, like, CAR T therapy, you already applying in Canada. Can you?
It's approved in Canada. Yep.
It's approved.
So there are hospitals that are doing it for like leukemia and different types of blood cancers. But if you want to learn more about it, if you Google CAR T bioinformatics, that's a really good website, and it has all the resources there about CAR T and everything. So CAR T bioinformatics.
Okay, right. And because we went through TRP and stem cell therapy pricing, can we go through the cost in this moment for anyone that is actually curious about the investment in CAR T therapy? Could you please share with us average?
I think for now, you can't. So it's tricky, because the only way I think at least in North America, you can access it is through a hospital where it's approved for certain uses. So you can only access it pretty much for blood cancers right now, and that's it. But we're working on building. So since we last talked, we're actually going to be building a hospital in Mexico, in Los Cabos. I got an offer to work with some of the people there. So it's going to be the first regenerative medicine hospital in the world. And we're going to offer CAR T there for different types of conditions. So yeah.
Okay.
It's
So in
exciting.
this moment, that is available, but in certain places where they actually treating blood cancer.
That's it, pretty much. Yeah.
Oh, so it's very limited, the use
Limited,
of CAR T
yes.
therapy.
But the application, like I said, can be very wide. So that's why we're gonna look to offer it for different conditions, and we're gonna work with scientists so that we can offer it for like like lupus, like potentially like other types of cancers, other types of conditions too. Yeah.
Okay. Okay. Wow. Okay. We're great. I think there is so much to grow in this field. Like I imagine, the more you know, the less you know, but it's
Yeah.
exciting that you continue surrounding with experts. They're also putting all these hours of work, and I imagine that it's not ending. It's like day after day and testing and trying to advance. So it's super excited to see someone and actually to be able to reach somebody like you. I am also curious about how it's going to be for next year. I will be in contact with you for the next year, since you are coming back in summer, I believe, hopefully, and you bring all these new discoveries. Let's just give us a little bit of, let's say, 2 tips for longevity. They're actually in our hands.
Yeah, so I think the 2 biggest tips to help you live longer, I think I said this probably in the first one, was but muscle. I just can't emphasize that enough, because people don't realize that if you don't have enough muscle, your quality of life and your longevity will be affected. So being strong and having muscle, and then probably the other thing I think that can really help with longevity is meditation practice, because if you don't have some sort of mindfulness or meditation practice, it's really going to take a toll on your health. And we know that there's biomarkers of longevity that can improve with meditation. And so I think those are probably the 2 biggest things.
Mm-hmm. And they're for free.
Exactly.
Yes, building muscle is definitely important to avoid sarcopenia. In sarcopenia, we actually take you down much faster in our way to lose muscle. Definitely, I will encourage everyone, and not to be a bodybuilder, but simply to start lifting some weight with proper supervision. This is super important for sure for longevity. And the number 2, you say meditation, which is my number 1 practice every day at 5 a.m, or as early as I can. I meditate to get my balance in my mind and to have a life with purpose. I know your mantra is live your best life. And we see that you are doing this every day. You are actually committed to understand the science and to bring researches and applications for our medicine in this time. So thank you so much, Dr. Can. I'm looking forward to hear from your experiences, and I wish you the best these last days of 2022.
Yeah, you too. I wish you a happy New Year, and everyone else. And yeah, it should be an exciting journey in Dubai and Italy and probably Mexico and Florida. So it'll be fun.
Super. Yes, I can't wait to hear the studies. So have a beautiful rest of the year. And for everybody, thank you so much for being connected. And if you have any questions, Dr. Can has actually a daily post in Instagram. His Instagram is Dr. Adil Can. And I will actually add it on the show notes for you to just click and follow him. If you actually have questions, he's really approachable. You can actually send him a message and he personally will reply to you if he's real. And yes, and we're looking forward to connect. And remember, my friends, that together we are stronger. I hope you really enjoy this talk with Dr. Ken. It was so fascinating to see how the stem cell therapy is growing so fast in Canada, and we cannot wait to see the discoveries of Dr. Ken and the evolution of medicine. As we are heading into a new year, 2023, we are welcome you to join our 30 days of hip healing exercises. If you are interested to learn how to mobilize your hips and to reduce your lower back pain, I welcome you to the 30 days practice, which will only involve about 5 to 10 minutes of stretches every day. That's the only commitment that we are asking you to do, is to commit for about 10 or 5 minutes a day. So what you do is you sign up into this app. You will have an app, you will have videos. I am going to be instructing you about how to stretch your spine, how to stretch your hip, and how to release any pressure around your lower back, especially for those that are sitting for long hours. I know this program, it will benefit you. It's about 30 days, which is great to create a habit. Remember, life is the result of the habits that we actually take. So I welcome you to the 30 days hip healing for the 2023. So please go to my website and check out this offer that is for the month of January. We are encouraging you to get connected to your family, to your friends. Just take a break from work and remember that having balance in life is essential. So let's just get ready for the day, or if you're ready to sleep, remember that here we are every week, and let's meet next week again. Thank you so much. Remember that together we are stronger.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.